Creating Psychologically Healthy Workplace Environments with an Emphasis on Culture by Renato Guadagnolo. This presentation will look at what organizational culture is, what are the characteristics of a good workplace culture, and what can we do about changing an unhealthy workplace culture. First off, we need to define what is organizational culture. Shine defines culture as a pattern of shared basic assumptions that was learned by a group as it solved its problems of external adaptation and internal integration, that has worked well enough to be considered valid and therefore to be taught to new members as the correct way to perceive, think, and feel in relation to those problems. So what does that mean in the workplace? Well, it means that the attitudes, values, and beliefs that guide workplace behaviors and influence the work environment on a daily basis can also affect the mental and physical well-being of employees. When we talk about attitudes, values, and beliefs, the ones that come up most frequently are trust, honesty, and fairness. So how do we know a good organization when we see it? Well, it holds everyone accountable, including the CEO. Everyone's ideas, values, and beliefs are important to the organization and not dismissed out of hand. Issues aren't just swept under the rug, but dealt with accordingly. There's also a spirit of community and group cohesion. Finally, there's trust between management and employees. So how important is trust in a healthy work environment? Well, it was the number one characteristic when Canadian employees were asked what makes a healthy work environment. More than wage, income, time off. So it's very important. So what happens if we have a poor work culture? Well, we get a lot of bad things like low commitment, loyalty, and lower levels of engagement and empowerment by employees. This can lead to physical and mental health issues, and finally burnout. Employees leave the organization, and you begin to have sort of a sinking ship type culture. So how can this affect occupational therapists? Well, let's think of a short-staffed OT unit at a hospital. They've had poor contract negotiations with management in the past and are now hearing of rumors of layoffs. They don't trust management enough to go up to them and ask them what's happening. So these rumors create work-related stress, which lead to increased absenteeism. So other occupational therapists try and pull up the slack, but this just furthers physical and psychological strain. Potentially, patient care could suffer, and these employees may experience burnout. So can we change culture? Should we even bother changing culture? Well, there's some research indicating that changes in culture improve work health in workplace. Organizational interventions seem to have had some success at reducing depersonalization, reducing staff turnover, reducing role conflict, role overload, and improving job satisfaction, absenteeism, civility, and trust of management. So how can we change culture in an organization? Well, there are many resources that we can look to in order to both evaluate and get ideas in which to shape culture. One of them is the Guarding Minds at Work website. They have a wide range of surveys with which to judge organizational culture. We can then look at the results of those surveys and use the guides and strategies available to improve culture in an organization. And some of the specific focuses include the environment of an organization, the training and development methods, communication between management and employees, and formal policies and procedures. But if there's one takeaway message, it's that a culture that promotes a healthy workplace can only be built on trust. If we need to focus on one thing, it's building trust between employees and management.